Imagine you're having breakfast when you suddenly feel pressure in the center of your chest. It isn't a sharp, dramatic pain. It feels more like something heavy is pressing down from the inside. You wonder if it's stress, maybe indigestion, so you decide to wait. But inside your body, a blood clot may already be blocking one of the arteries that supplies your heart. With every passing minute, part of your heart muscle is being deprived of oxygen, and the damage may be growing. A heart attack doesn't always look like the dramatic collapse we see in movies. It may begin slowly with mild discomfort, unusual fatigue, nausea, shortness of breath, or even pain in the jaw. That is why recognizing the warning signs and knowing what to do next can mean the difference between recovery, permanent heart damage, and death. In this video, you'll learn the warning signs of a heart attack, what causes it, what you should do immediately, and how to reduce your risk in the future. This information could help you save a life, possibly your own. The most common warning sign is discomfort in the center or left side of the chest. People describe it in different ways: pressure, squeezing, heaviness, fullness, tightness, burning, or pain. It may last for more than a few minutes. In some cases, it disappears and then returns. But chest discomfort is not the only warning sign. Pain or discomfort may spread into one or both arms, the shoulders, upper back, neck, jaw, or stomach. Some people experience shortness of breath. This can happen with chest discomfort, but it may also happen before any chest pain begins. Other possible signs include a cold sweat, nausea, vomiting, dizziness, weakness, or feeling as though you may faint. An unexplained wave of extreme tiredness can also be a warning, particularly when it feels different from normal fatigue. Symptoms are not identical in everyone. Both men and women can experience chest pain or pressure, but women may be more likely to experience additional symptoms such as nausea, shortness of breath, back or jaw pain, and unusual fatigue. Older adults and people with diabetes may also experience less obvious symptoms. The important point is this: a heart attack does not have to begin with unbearable chest pain. If several of these symptoms appear suddenly, especially chest pressure combined with shortness of breath, sweating, nausea, or pain spreading through the upper body, treat the situation as an emergency. Do not wait for every symptom on this list to appear. To understand why a heart attack happens, we need to look inside the arteries that supply the heart itself. Over time, cholesterol and other substances can accumulate inside an artery, forming a deposit called plaque. This process is known as atherosclerosis. As plaque grows, the space available for blood to flow may become narrower. But the most dangerous moment can happen when the surface of a plaque suddenly ruptures. The body reacts as if an injury has occurred and forms a blood clot at that location. If the clot blocks the artery, oxygen-rich blood can no longer reach part of the heart muscle. That muscle begins to suffer damage. The longer blood flow remains blocked, the greater the potential injury. High blood pressure, high cholesterol, smoking, diabetes, obesity, physical inactivity, age, and family history can all increase cardiovascular risk. A heart attack can occasionally have other causes, such as a severe spasm of a coronary artery, but blockage related to coronary artery disease is the most common cause. Whatever the cause, this is not a problem that can safely be treated at home. Restoring blood flow requires urgent medical care. If you think you or someone near you may be having a heart attack, call emergency services immediately. In the United States, call 911. In much of Europe, call 112. Otherwise, use your local emergency number. Call even if you are not completely sure. It is far safer to be examined and learn that it was a false alarm than to lose critical treatment time. Do not attempt to drive yourself to the hospital. An ambulance is not simply transportation. Emergency medical professionals may begin evaluating and treating you on the way, and they can alert the hospital before you arrive. While waiting, stop all physical activity, sit in a comfortable, supported position, and try to remain as calm as possible. Loosen tight clothing and keep your phone nearby. If another person is present, ask them to stay with you. If you have been prescribed medication for an existing heart condition, Follow the emergency instructions previously given by your healthcare professional. You may have heard that aspirin should always be taken during a suspected heart attack. Aspirin can help in some situations, but it is not safe for everyone. Call emergency services first and ask the dispatcher whether aspirin is appropriate. Do not take it if you have an aspirin allergy, a serious bleeding risk, or have been told by a healthcare professional not to use it. Do not rely on unproven techniques such as repeatedly coughing, hitting the chest, drinking water, or trying to walk off the symptoms. These actions do not remove the blockage and may delay life-saving treatment. Now imagine that the person suddenly becomes unresponsive and is not breathing normally. That may mean cardiac arrest has occurred. Call emergency services, begin CPR, and use an automated external defibrillator, an AED if one is available. Follow the dispatcher's instructions until trained help arrives. Remember, a heart attack and cardiac arrest are not the same condition, but a heart attack can sometimes trigger cardiac arrest. At the hospital, medical teams may quickly perform an electrocardiogram, often called an ECG or EKG, and blood tests to determine whether heart muscle has been damaged. Treatment depends on the type and severity of the heart attack. Doctors may use medicines to prevent additional clotting, reduce the heart's workload, control symptoms, or help restore blood flow. In many cases, a procedure called coronary angioplasty is used. A thin tube is guided to the blocked artery, a small balloon opens the narrowed area, and a stent may be placed to help keep the artery open. Some patients may require coronary artery bypass surgery or other specialized treatment. After the immediate danger has passed, recovery continues. Medication, follow-up care, and cardiac rehabilitation can help the heart recover and reduce the chance of another heart attack. Never stop prescribed heart medication or change its dosage without speaking to your healthcare professional. Many important risk factors can be managed. If you smoke, getting support to quit is one of the most powerful steps you can take for your heart. Know your blood pressure, cholesterol, and blood sugar levels. These conditions can cause damage for years without producing obvious symptoms. Build regular physical activity into your life at a level that is safe for you. If you have a medical condition or have been inactive for a long time, speak with a healthcare professional before beginning an intense exercise program. Choose more vegetables, fruits, whole grains, beans, nuts, and other minimally processed foods. Limit excess salt, added sugar, processed meat, and foods high in saturated or trans fats. Work toward a healthy weight, prioritize consistent sleep, and find sustainable ways to manage stress. Most importantly, attend regular health checks and take prescribed medication exactly as directed. Prevention is not about being perfect. It is about steadily reducing the risks you can control and recognizing an emergency when prevention is no longer enough. If you remember only one thing from this video, remember this: chest pressure, pain spreading through the upper body, shortness of breath, cold sweating, nausea, or sudden weakness may signal a heart attack. Don't wait. Call emergency services. Knowing these warning signs could help save someone's life. Share this video with someone you care about and subscribe to Dr. Baro Body Signals for clear, practical health guidance. Spot it. Act fast. Stay safe.